If you get your yearly mammogram and everything checks out okay, you feel good that you're protecting yourself from breast cancer, right? But do you know if you have what's considered dense breasts, mammograms are more likely to miss cancer? All this week, we're breaking down a new law that will require that providers tell you in your results letter if a mammogram finds that you have dense breast tissue. Joining me now in studio to talk more about this, Dr. Judy Smith, Chief of Oncology at Spectrum Health. Can you walk us through what triggers some of these notifications?
Sure. Well, when a woman gets a mammogram,
right.
What the radiologist will read the exam, and they'll decide whether or not it's complete, whether or not there's any abnormalities at all, benign, whether something's suspicious. But in addition to that, one of the things that they do read is whether or not there's density in your breast, or whether you have what's called dense breasts. And they look at the tissue in the mammogram, and if you've seen any kind of x-ray, there's black and white. White is density or fibrous tissue, and cancers can hide behind whiteness because cancers also are white. So the more dense breast tissue there is, the more difficult it is for the radiologist, for the mammogram, the individual who's reading the mammogram, to actually find the cancer.
Right.
So they look at the degree of density and will then, if it's very, very dense or has quite a bit of density, because there's like 4 levels, and the top 2, the little bit worse, those are the 2 where they'll say to you in your letter, you have dense breasts. Now, you shouldn't panic.
Right.
What this means is simply that you have a slightly higher risk of having a cancer or getting a cancer, and you need to just, relax, because it is, if you have just a little bit of dense breasts or moderate amount, your risk is only very, very small in terms of the increased risk.
It really becomes a matter of being able to see that tumor if there is one in that white tissue.
That's exactly
So there's
right.
sort of a scorecard, as you mentioned.
Correct.
You touched on this. I think it's 4 levels, 4 categories.
Correct.
Let's talk a little bit about that. What should a woman know about this scale?
Well, I don't really believe that women need to know the details about this, except if you're told you have dense breasts, you would be either C or D on this scale, which is heterogeneously dense,
right,
which is a negligible increase in risk, or have extremely dense, at which point you have a little bit higher risk. But remember, dense breasts are not the major risk factor for cancer. So this is only one of multiple factors that really helps you decide what, if anything, more you should do.
So if you're heterogeneously or extremely dense, your results letter will now say, by law, starting June 1st, that you have dense breasts. You
Correct.
should talk to your doctor about supplemental tests beyond mammograms, just to be able to see, what's in that white tissue that normally wouldn't be able to show clearly whether or not there was a tumor. So as a doctor, what do you advise your patients at that point? What do they do next?
Again, you shouldn't have to get more tests at that moment unless you're extremely high risk. So the doctor will sit down with you and do a Gale risk assessment. We have a high risk clinic where if you do have other risk factors, you can come to the cancer center and be assessed for your degree of risk. If you have a family history of breast cancer, if you have a genetic predisposition to breast cancer, if you have a personal history of breast cancer, all of those are far more important than the degree of density. But density is additional, just a little bit more, that
right.
goes into the equation. But then, if you need additional tests, your doctor will recommend that you have either an MRI or what's called a 3D tomosynthesis. Mm-hmm. And that is just a more effective mammogram that is able to see through the density and kind of spins the picture so it can see behind. And that is a much higher efficacy with dense breasts.
Right.
And oftentimes you can do that next year. It's not an urgent issue where you need to get it done right away unless you have other risk factors.
Well, what most doctors are saying, I guess, if you can't see through that white tissue and there could still be a tumor in that area, why wait?
Well, because you do have additional risk from getting radiation over time. But again, we've been doing this for 50 years and have markedly improved the cure rate for cancer. And it's probably not indicated to get over-evaluated either. Either way, it will degree on your physician and your decision-making with your physician and your overall degree of risk as to when and what more you get.
So further discussion with your doctor.
Absolutely.
Then on
That's
that
the most
density.
critical.
Okay. Doctor, thank you so much for joining us. We appreciate it. Our coverage of how this new law could help you catch breast cancer earlier continues all week on 24-Hour News 8 and 8 West. Tonight, WOTV4 for Women will dedicate an hour to examining this critical issue. Miranda, Where You Live at 7 o'clock, and then join us at 7:30. Breast cancer, real women, real stories.